Thank you. So as we know, the cornea is very important for vision, and the epithelium is specifically a very, very important layer of the cornea. We know that epithelium is made of stratified, non-keratinized, transparent avascular cells which interact with the tear film, and this is very important to maintain its integrity. It also has a sensory innervation by the trigeminal nerve, which is extremely important to maintain its trophism. So, and we know the importance of that, not only for releasing some of the factors that keep the cells with their migration and proliferation capacity, as well as it started the blinking reflex as well as the tearing reflex. So the innervation is extremely important to keep the ocular surface stable. We also know that the corneal epithelium has cell receptors between the cells, and also the basal epithelial cells, they have specialized cell junctions with the basement membrane and stroma. So any problem in these junctions, as well as in these intracells and basement membrane and stromal junctions, you can have problems in the epithelial integrity. We also know that the limbal stem cells, they live in they stay in the limbus, and they are very important to to divide into the transient epithelial cells, post-differentiated, so they keep the epithelial mass that is very important for the regeneration process that respect the X, Y, and Z hypothesis. So when you have an epithelial defect, then you have like an abrasion, then you have a disbalance of this equation, and you start a healing process. And the healing process has different components related to the migration, proliferation, and adhesion. All of these components, they happen in the same time, but they are very important for keeping the epithelial integrity. We also know, because the epithelial, you don't have vessels in the cornea, so the epithelial healing, it's very important that the extracellular matrix like fibronectin, hyaluronic acid, collagen, laminin, and all the substances for the epithelium to migrate. So when you have an epithelial defect, all these substances, they keep here, and the cells, they move over this matrix proteins, so it's very important, this contact, for the cells to migrate. We also know that the epithelial cells, as well as the keratocytes, they produce other growth factors which are very important for the corneal epithelial healing. So EGF, TGF, and a lot of these growth factors, they have a very important role in the epithelial migration and proliferation. So what were the causes that cause persistent epithelial defect and problems in the epithelial healing? Well, you have many causes. The first ones related to the lid function, tear film abnormalities, traumatic, medications and toxicity, post-infection, metabolic, immune situations, especially the diseases like Stevens-Johnson's and pemphigoid and atopic diseases, neurologic diseases, neurotrophic and neuroparalytic, and other causes. And treatments can be divided in medical treatments and surgical. So let's start with the medical treatments. We know that we can treat some of these persistent epithelial defects with lubricants, either in the eye drop, gels, ointment formulations. And usually when you have an epithelial defect, it's good to use a preservative-free eye drops. You have different polymers, different molecules, and we know that some of these lubricants can also incorporate some of the extracellular matrix compounds, which are very important for the epithelial migration. And one of them is fibronectin, which is helpful, but in a few studies, although it looks like helpful, it's not very easy to be synthesized, and so it's still not available for the treatment. It's not commercially available for the treatment of epithelial defect. The other substance is sodium hyaluronate, and we performed a few studies in cell culture, in corneal epithelial cell cultures, comparing sodium hyaluronate with other viscoelastic and a control group. And what we found is that the sodium hyaluronate increased the migration of cells comparing to the other two groups. And it's important that we notice in these studies that epithelial cells, they present the receptor for hyaluronic acid, which is the CD44 in most of the cells. We also know that in vivo studies, in animal studies, they also show this capacity to increase migration. And so hyaluronic acid can be used to treat persistent epithelial defects. We also have growth factors. Epidermal growth factor is one that has been used to treat epithelial defect, but the results are very controversial. It looks like that if you don't increase a lot the concentration of EGF, you don't find a good result either in experimental or in the humans. Topical treatment with nerve growth factor can be useful, and we can see in the next lecture the results of the NGF, as the Italian group has started doing these studies a few years ago, and now it's almost ready for commercial use. We also have EGF, which seems to decrease the epithelial defect. This has done mainly by the Japanese groups, by Nishida, and also can be used to decrease the epithelial defect. Serum and components, very powerful, and it has been shown by Tsubota that it's very useful because it not only has growth factors, vitamin A, as comparing to the tears. You see that they have EGF, vitamin A, EGA, and fibronectin. So it's very useful for when you have epithelial defect. And there are a few papers showing the utility of using autologous serum application for these conditions. It's important that you need to prepare, to take care, because it contaminates very easily. And also, in our hands, the best dilution is this, between 20 to 30%. There are a few papers showing that when you have pure autologous serum, you can have some toxicity to the keratocytes. So it's maybe not very good for epithelial defect. But you have other serum, other blood components, as the platelet-rich plasma, which has been shown to be more efficient than the autologous serum. Also albumin, and also more recently umbilical cord serum, which has been used in ocular chemical burns, and it has been shown to be very useful for treating epithelial defects. Now, let's talk a little bit about other anti-inflammatory medications. One is the tetracycline and derivatives, which decrease the MAP kinase activation and metalloproteinases, so it can be used to treat persistent epithelial defects. Other anti-inflammatory, either steroids and other immunomodulators, can also be used. There are a few papers showing good results with topical cyclosporine and tacrolimus in a few cases. It's interesting to mention something about patching. So when you have an epithelial defect, should we patch or use contact lens? Well, there is this Cochrane systematic review, which show that if you patch one eye for 1 day, 2 days, or more than 2 days, you don't have a beneficial effect. And this study concludes, comparing all the days that the eyes were patching, that treating simple corneal abrasions with a patch does not improve healing rates, And in addition, use of PETs results in loss of binocular vision. So it's recommended that PETs should not be used for simple corneal abrasions. Contact lenses can also be used, and we know that with the new materials you can have even a better effect, and it can also be used as the delivery system for drugs. So this is a study comparing silicone hydrogel in the use of treating epithelial defect. There's the scleral lens, in which you can use for not only treating but deliver substances, so this is also useful for treating epithelial defects. Surgery. Well, amniotic membrane has been used. We know that the basement membrane of amniotic membrane is very similar to the corneal, and we know that it can be used either as a patch in cases of epithelial defect, like in Stevens-Johnson's acute stage, very useful, but or in the contact lens amniotic membrane, or you can use when you have a sterile ulcer. And just to finish my presentation, I just want to show you a summary of this study, in which we get 47 eyes, 19 with corneal thinning, and we divide in two groups, and we randomize between amniotic membrane transplantation and corneal grafts. And here are the surgeries, and I just want to show you the results. This is the pre-post-op of the cases that received the amniotic membrane, and this is the ones that received the corneal lamellar graft. And what we notice is that the lamellar graft is better in terms of keeping the thickness of the cornea comparing to the amniotic membrane. The epithelialization time was about the same, but the amniotic membrane was better in terms of decreasing neovascularization comparing to the corneal lamellar patch. So in conclusion, persistent and recurrent epithelial defect can appear in different conditions. Treatment includes the use of topical medication, including lubricants, extracellular matrix, growth factors, serine components, protease inhibitors, anti-inflammatory, contact lens, and also surgery with amniotic membrane and other surgical procedures. Patching seems not to be necessary for the treatment of this condition. Thank you.